Welcome back. Dr. Scruggs, let's go back to you. What is it about mycoplasma bovis that makes it fundamentally different from some of the other BRD pathogens?
Well, Jim and Ryan brought up a couple of points earlier that kind of highlight what I'm about to say. One of the things that's different about mycoplasma bovis, as I said earlier, it generally produces a slowly progressive, more chronic disease. And because of that, a lot of times early in the disease process, you don't recognize the cattle as sick. They may look like they're just not starting well. They're not filling up well, just a variety of things. And then a week, 10 days later, you say, well, by golly, maybe he has been sick since the beginning. The problem with that is that those cattle, number one, tend not to be recognized as early in the course of the disease to where treatment is not as effective. Secondly, that gives those cattle plenty of opportunity to spread that organism to their pen mates. So that's one thing about it, is the slow way that it moves, the slow way that it develops within cattle. And because of that, it tends to spread within a population pretty quickly before we recognize it's a problem. So once that disease you said it earlier, once that disease gets some momentum, it's hard to get in front of. And that's one thing we have to remember about mycoplasma bovis. The other thing is that unlike a lot of our other diseases, like if they get Mannheimia or if they get BRSV, they get it, they're sick for a week, maybe 10 days, they get over it and they're not really a risk to their pen mates. With mycoplasma bovis, once they're infected, they tend to remain chronically infected for months.
Wow.
So with that, even if they're not severely affected, they're a source of infection for their other pen mates. And that gets us back to how you manage this disease, is when you have non-responding cattle, cattle that tend not to respond to treatments, the worst thing we can do is expose those to otherwise healthy cattle.
Gotcha.
So that's one of the things that's unique about this disease is, yes, we have some effective drugs for it, but it has to be coupled with a management strategy to interrupt the momentum of that disease, is what you mentioned. And the third thing about it is this organism tends to produce chronic changes in the lung that cause permanent changes from which that calf is less apt to recover fully. That's how it stays in the lungs, is it causes some permanent changes that allows it to stay there and allows those lungs to be more susceptible to infection with other organisms.
Over time. Dr. Blood, given your experience, why is it so important to understand the pathogen you're dealing with when you begin treating either an animal or a herd of animals that you think it has a problem with BRD?
One of the problems with BRD, or bovine respiratory disease, is by definition it's a syndrome, and by definition there is and usually are multiple pathogens involved in that syndrome. You know, we've got the bacterial pathogens, including the mycoplasma, as well as the viral pathogens. So typically what we would see in our feed yard situation, it's hard for our cowboys or pen riders to differentiate. That's a Mannheimia, that's a virus, or that's a mycoplasma. So we tend to rely on the drugs that will, in our experience, do the best job of treating that whole array of pathogens.
Well, and so let's talk about treatment options. In your experience, what are some of the treatment options?
Well, if we look at all the antibiotics that we have available to us, mycoplasma specifically has some unique characteristics that make it resistant to the treatment with some antibiotics. And the main case would be the penicillins and the cephalosporin on one end that it's biologically impossible for them to have an effect on mycoplasma. And on the other end of the spectrum, we would have Draxxin, which is currently the only drug we have available that is specifically labeled for mycoplasma. And then some of the other drugs in between. Ryan mentioned the tetracyclines earlier, that we thought we might have saw some help on mycoplasma earlier when we first started seeing some mycoplasma. So that would be the extremes that we do see.
What would you add to that, Dr. Scruggs?
Well, what I'll add to it is mainly that we have to emphasize that once you recognize a card-carrying case of mycoplasma, it's too late to affect treatment very well. And that's one of the things that we run into, is that by the time you have a blown-up joint, or it's obviously a calf that's going backwards and drying up on us, kind of like these mycoplasma calves do, it doesn't matter really what we treat them with. There's a low level of success there. So the point of it is a lot of these cattle are infected with mycoplasma the first time they're pulled. There's some studies out there that show that roughly 80 to 85% of the cattle with acute pneumonia are also infected with mycoplasma bovis. So it just makes sense to me that your first treatment should be designed at attacking mycoplasma bovis, even if you don't think that's the primary cause. Our data indicates that in a lot of cases, especially highly commingled cattle, that it's probably there from the first treatment.
Gotcha.
So designing treatment protocols to address it early in the course of the disease seems to make sense and gives us more treatment success.
So Ryan, back to you. I mean, do you still find that you're having some mycoplasma bovis problems in your operation, or tell us what you're doing to treat or prevent against that?
Yes, sir. I feel like that we still have mycoplasma at any given time. And origin of the cattle has a lot to do with it. The commingling of cattle coming from sale barns and 3 or 4 different sale barns, we see a lot of those cattle that are high risk for mycoplasma. You put a calf on a truck for 1,000, 1,100 miles coming from the southeast, they're going to have a high risk of mycoplasma. And our prevention is we still believe that if you use a good modified live vaccine and have timely revac programs, because I feel that if you hold off some of them other diseases, your BRD, BRSV, and all them things, it will help with a healthy calf to keep mycoplasma from entering, because mycoplasma is just something that's there all the time.
Gotcha.
And our high-risk calves that have a long trip or commingled at sale barns, we feel that mass treating with Draxxin up front is one way of doing it. If we get a nice healthy bunch of calves that's one brand, one owner type deal, or been through a preconditioning type shots before weaning, we do not use Draxxin up front as a mass treat.
Okay.
But Draxxin, we have found in the last 2 years, we use it first. And the reason is just what both our doctors said here today, is that you've got all these different signs of what your pen riders are pulling for. Is it mycoplasma? Is it BRD? Is it BRSV? You know, I mean, and we're learning. We've learned how to treat after an animal's been treated with Draxxin,
Okay.
to give them time. We've learned how to just get with Draxxin right away, and I believe there's a lot of good antibiotics out there, but in our system we are using Draxxin first, and then we try to give that calf some time. Now I've seen Draxxin come back and get you 30 to 60, 90 days later. And we have a lot of little Holsteins that are coming from the Northwest, and we'll run them some oreomycin every 30 days, no matter what ration they're on. And also, we'll run some of our high-risk calves some oreomycin about day 14 when we're going to revac.
Gotcha.
And knowing that Draxxin is the only thing, I mean, that's the only thing on our bag that's cleared from mycoplasma.
Gotcha.
We feel in our operation that an extensive vaccination program and some use of oreomycin in our feed or some kind of crumbles helps. And that's basically what we're doing. But it's a big-time deal.
So you bring out the big gun first.
I bring the big gun first. I've tried everything. I'm a young man, but I've been in the cattle business since I was very young, and I've had a lot of high-risk calf experience in the last 15 to 20 years. And Draxxin is the best product, my opinion, to come first with, because you can always follow up. Because Draxxin's not only going to get mycoplasma, it's a broad-spectrum antibiotic that's going to help with BRD or BVD or anything. And so that's what we do, and it seems to work. And like these gentlemen said here, it can linger on you and create. It's catastrophic to the beef industry.
Sure,
it really is.
Well, Jim, let's talk and ask you the same question. Do you still believe it's a problem in your operation, or is it something that's at bay now? What have you done to treat or prevent that?
We feel like we pretty much got it at bay. We do a mass treatment on arrival and it doesn't matter whether they're high risk or whatever. Our cattle all come from probably a 60 to 100 mile area, local cattle, and
a mass treatment of
Draxxin on arrival.
Gotcha.
Along with a complete preconditioning program, the Pfizer program there too.
Okay.
And we were just having tremendous results with it ever since I think it was introduced like in the fall of 2005, the Draxon was, and we've just had incredible results. We're pulling out of the 500 and some calves that I've started in the last 60 days, we have pulled less than 2%, and 4 of those were coccidiosis calves.
Wow.
For 4 calves that were. And I'm able to turn these calves out in 2 weeks to pasture, where it was maybe 30 days that I even felt like I could send them out.
Wow.
And now, along with what Ryan said with the crumbles, I've eliminated that from my feed too.
Gotcha.
So
there have been several benefits.
exactly.